Hello, it's Dr. Rhonda Johnson. Today is Thursday, March 24th, 2022, and today I'm going to be discussing the color of COVID deaths in the United States. Now, much of the information in my message comes from the website of APM Research Labs, and their data is up to date as of March 15th. But first, my opinion. Although racial and ethnic classifications are widely used in the United States, race and ethnicity are defined by society, not genetics. There is only one race of people in the world, the human race. To put it another way, no matter where people live in the world, no matter what they look like on the outside, humans are remarkably genetically similar. They share approximately 99.9% of their genetic code with one another. Now back to the color of COVID in the U.S. According to APM Research Labs, the color of COVID deaths in the U.S. looks like this in terms of age-adjusted rates. You are far more likely to die from COVID if you are Indigenous, Pacific Islander, or Black. Now I'm going to share some numbers. 1 in 230 Indigenous people have died of COVID. 1 in 298 Pacific Islanders have died of COVID. 1 in 303 Black Americans have died. 1 in 319 white Americans have died. 1 in 394 Latino or Hispanics have died. And 1 in 641 Asians have died. Now, the higher death rates among people of color likely reflect the higher rates of infection among people of color. You know, if you don't get infected from COVID, you can't die from it, right? So people of color have increased exposure risk due to working and living and transportation situations, including being more likely to work in jobs that cannot be done remotely, more likely to live in larger households, and to have to rely on public transportation. In addition, there may be disproportionate burden of underlying chronic medical conditions such as obesity or diabetes, high blood pressure, and chronic respiratory conditions. And there's the issue of lower vaccination rates in some of these demographic groups. I've already previously discussed lower COVID-19 vaccination rates in Black people here in the United States. But remember that the COVID vaccines are very effective in reducing your risk of dying, no matter what race or ethnicity you are if you get infected. So that's my message today. As always, my views are my own. Please stay safe, folks.